This is CGTN, China Global Television Network.
Tunisia's health ministry says the COVID-19 pandemic is under control despite increased pressure on medical facilities due to the country's fifth wave of infections. The number of hospitalizations across the North African nation has gone up significantly since December last year. And as Adnan Chauchi tells us, frontline health workers are demanding more support, equipment and better remuneration to face the pandemic.
The General Directorate of Public Health Facilities says that most patients admitted in COVID-19 units need medical oxygen. Consequently, the occupancy rate of beds fitted with oxygen concentrators is higher than the demand for intensive care beds.
We are facing the fifth wave of the pandemic. It started in December. The health department has followed the same procedure for hospital, human resources, the availability of beds or oxygen. This system is updated continuously depending on the evolution of the number of positive cases, hospitalized patients in the ICU or hospitalization beds.
Health authorities in Tunisia say that demand for medical oxygen is close to 77,000 liters per day, while the daily production capacity is 100,000 liters. The North African country has 600,000 liters of strategic medical oxygen reserves.
We continue to follow the evolution of the consumption of oxygen. The current situation is stable for oxygen availability. It's necessary for hospitalized patients. Medical oxygen is the first cure for the complicated cases. The crisis unit at the Health Ministry is managing the oxygen procurement. We are all on alert.
More than 50 frontline doctors have died since the outbreak of the pandemic in Tunisia in March 2020. Health professionals have delayed several strikes. However, doctors' unions at public hospitals are advocating for better working conditions.
The health authorities are pushing us to strike despite the humanitarian character of our job. Frontline medics have legitimate demands. Working amid the pandemic is risky. We deserve better conditions in Tunisia.
The Tunisian government scientific committee for the fight against the coronavirus announced that 5,000 oxygen concentrators were made available to hospitals. 6 oxygen generators are operational. 4 others are being installed. According to the Department of Public Healthcare Facilities, 4 field hospitals are now operating out of 12 to reduce pressure on public hospitals. Tunisia has recorded more than 26,500 COVID-related deaths since the outbreak of the pandemic in the country in March 2020. Adnan Chauchi, CGTN, Tunis.